Hi, good morning. My name is Madeline Tamayo. I'm going to do a head-to-toe assessment. First, I will show you the room. So here, there, and I'm gonna do my hand hygiene, wear my gloves, and clean all the equipments that I'm going to use. So my patient is 92-year-old elderly man who fell 2 days ago in his home. Okay, so we're gonna bring this to my patient. Hi, good morning. Can I please check your ID, Ben? Can you please tell me your name?
William Overton.
Thank you so much, Mr. William. My name is Madeline Tamayo. I'll be your nurse today, and I'm going to do a head-to-toe assessment. Is that okay with you?
Yes.
And are you comfortable right now?
Yes.
Do you need to go to the washroom?
No.
I'm going to close the door for your privacy. And Mr. William, I have questions regarding your fall. So, is this your first time falling?
Yes.
No. Do you have any history of falling before?
No.
Where did you fall?
In the kitchen.
How did you fall?
I trip.
Were you feel dizzy that time?
Yes.
And did you hit your head?
No.
So, are you in pain right now?
Yes.
So, could you please rate me your pain from 0 to no pain and 10 to severe pain?
2.
Where is the pain?
In my right hip.
Okay, so does the pain stay longer or does it go away?
Does that go away?
Okay, so Mr. William, do you have any hard time walking?
No.
Do you use any assistive devices?
No.
Are you taking any medications?
Yes.
So what type of medications are you taking?
For high blood pressure.
So Mr. William, are you living alone or you with someone?
I'm alone.
So who found you when you fell?
My neighbor.
Okay, thank you so much, Mr. William, for answering my questions. Now I'm going to assess the physical appearance of the patient. So my patient is 92-year-old. His color is brown and no other. Body structure is what? Could you please tell me your height?
5'7".
So my patient is 5'7", good, well-nourished, and no deformities and good posture. The behavior of my patient, there's no abnormal facial expression. He's calm, dressed appropriately and maintaining eye contact. And could you please stand up? And could you please walk one forward and walk step backward? Thank you so much. Do you feel any pain?
No.
And I don't see any distress of breathing. And I will assess the level of consciousness. Mr. William, could you please tell me your name?
William Overton.
And where are you now?
In the hospital.
What time today?
12.
So thank you so much, Mr. Williams. So my patient is awake and alert, able to answer my question. Now I'm going to inspect and palpate the head of my patient. So the shape of the head is normocephalic. I don't see any lesions, no scars. And could you please tell me if you feel any pain?
No.
No pain, no tenderness, no lumps, no nodules. The hair, the color of the hair is black. It's well distributed. There's no infestations or foreign body present. Now I'm going to palpate, inspect and palpate the face. So the face, there's no pigmentations, no scars, no lesions. Do you feel any pain?
No.
No pain, no tenderness. Now I'm going to check for the cranial nerve facial. Could you please smile? Show your teeth. Could you please frown like this, and lift your eyebrows, close your eyes tight, and puff out your cheeks. Thank you so much, Mr. Williams. So it is symmetrical, it is normal, and cranial nerve facial is intact. Now I'm going to check the eyes of the patients, the lids, lashes, eyebrows. The lashes and eyebrows are the hair is well distributed, the color is brown. The lids, there is no ptosis, no lid lags, and the scleras are white, conjunctivas are pink. There is no discharge, no crusting, no exophthalmos, and it is symmetrical. Now I will gonna check the cranial nerve oculomotor. So the shape of the pupils are round. It is symmetrical. Now I'm going to check for the direct and consensual reflex. So the pupil constrict when I shown the light, and consensual is the pupil constrict also when I directly shown the light. Now, Mr. William, could you please stare on this? So that's good. And the perla is pupil equally reactive to light, and accommodation is good. Now I'm going to check for the cardinal gaze. Could you please follow this without moving your head? Thank you so much, Mr. Williams. So cranial nerve oculomotor is intact. Now I'm going to check for the optic. I will. Could you please close your this and then say now when you see my hand.
Now. 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 Now.
And then the other one.
Now. 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 Now.
And I'm going to give you this Snellen chart. Could you please read the letters that you can see?
L T F P H.
So the vision of the patient is 20/20, which is good. So cranial nerve optic is intact. Now I'm going to check the ears of the patient. So the color is brown. It is symmetrical. I don't see any cerumen or discharge or foreign body present. Now I'm going to palpate the auricle and the tragus. Please tell me if you feel any pain or tenderness.
No.
No pain, no tenderness. Now I'm going to do whisper test.
ABC. 1, 2, 3.
So the patient is able to hear the word that I whisper, which is good. Now I'm going to check for the external auditory canal and the tympanic membrane by pulling the pinna up and back. So the tympanic membrane, I mean the external auditory canal is pink. There is no cerumen, no discharge, and the tympanic membrane is pearl gray and shiny, no bulging, no perforation. Now I'm going to test the patient levers and reading test. So you're gonna hear the vibration, Mr. William, and say now at the end when you hear that the vibration is already ended. Okay?
Now.
Okay.
Now. Now.
Thank you.
Now. Now.
Thank you so much, Mr. William. So it is good. The patient is able to hear the vibrations. Now I'm going to check the patient's nose. So the nose of the patient is in the midline. There is no flaring, no crusting, no discharge. Now I'm going to palpate for the frontal and maxillary sinuses. So this is the frontal and this is the maxillary. Do you feel any pain or
No.
tenderness? No. Now I'm going to check for the olfactory nerve smell test. Could you please close your other nostrils and I will give you this scent and tell me what it is.
Lavender.
Thank you. And close the other one.
Coconut oil.
Thank you so much. So the patient is recognize the smell. So cranial nerve olfactory is intact. Now I'm going to check the mouth and pharynx of the patient. So the lips the color is pink. There is no lesions, but it's a little bit dry. Could you please smile and show me your gums? So the gums are pink. There is no lesions, no bleeding. Teeth are white, and there is no dental caries. And now I will check for the tonsils. So could you please say Mr. William? So there's no appearance of tonsils, so grade 0, which is no appearance, is good. Now I will gonna check for the tongue. So tongue, the color is pink. There's no lesions, no swelling. Now I'm going to check the hard and soft palate. So hard, you just put your tongue down. Hard and soft palate. So the hard palate is white and pink. There's no lesions, and soft palate is also pink. There is no lesions. Now I will gonna check the cranial nerve, glossopharyngeal and vagus. And could you please say ah? So the uvula and the soft palate are rising. So the glossopharyngeal and vagus is intact. Now I'm going to check for the cranial nerve, hypoglossal. Could you please put your tongue out and move from side to side and say light type dynamite.
Light dynamite.
So the patient is able to say it without tremors. Cranial nerve hypoglossal is intact. Now I'm going to check for the neck of the patient. So the neck is in the midline, the color is brown, there is no lesions, no scars. I'm going to palpate it. Do you feel any pain?
No.
No pain, no tenderness, no crepitus. There is no enlargement of the thyroid, and the trachea is in the midline, and there's no pulsations, and it is symmetrical. Now I'm going to check for the carotid artery. Could you please move your head here? And I'm going to palpate. Okay, this one. So the carotid artery, the rhythm is regular, grade strength is 2+, and it's equal on both sides. Now I'm going to check the spinal accessory of the patient. Could you please move your head with my hand's resistance? And this one, and this one. Okay, so the patient is able to move his head and his shoulder with resistance. The spinal accessory is intact. Now I'm going to check for the patient's lower extremities, I mean upper extremities. So by inspecting it, the upper extremities, the color of the upper extremities are brown. I see a little bit of scars on the right side. Good hydration. No, there is no joint inflammation, no diaphoresis. Hair is well distributed, and there's no involuntary movement. Right side is symmetrical to the left side, and there is no skeletal deformity. I'm going to palpate your arm, Mr. William. Do you feel any pain?
No.
No pain, no tenderness. Temperature is normal. Joint temperature is normal. There's no masses, and there is no swelling, no good skin turgor, good moisture. Now I'm going to check the nails of the patient. So the color of the nails are pink. The shape is a little bit flat or curved. Capillary refill is less than 3 seconds, which is good. And that there is no involuntary movement. Now I'm going to check for the range of motion. Could you please stand up? And we'll do, could you please flex your finger, extend your finger, flex your wrist, extend your wrist, radial deviation, ulnar deviation, and flex your elbow, extend your elbow, do pronation, supination, and abduct, internal rotation, external rotation. Do you feel any pain?
No.
No pain, no tenderness, no altered range of motion. Now I'm going to check for the radial pulse. So the radial pulse, the rate is 70, rhythm is regular, and grade strength is 2+, and it's equal on both sides. Could you please grasp my hand? And then the other one. So the strength is good. And now I'm going to check for the lower extremities of the patient by inspecting it. So the lower extremities, there is no scars, no lesions, and the color is brown. Hair distribution are good. No diaphoresis. There is no skeletal deformities. Right side is symmetrical to the left side and no involuntary movement. I'm going to palpate it. Do you feel any pain?
No.
No pain, no tenderness. Temperature is normal. Joint temperature is good. There is no masses, no swelling, and there is no crepitation. And I'm going to palpate for the dorsalis pedis pulse. So it's good, and the posterior tibialis. So it's palpable. So the rhythm is regular, and grade strength is 2+. Could you do dorsiflexion and plantar flexion? And then the other one, dorsiflex and plantar flex. Do you feel any pain?
No.
So the patient is able to do dorsiflex and plantar flex. Now I'm going to remove my gloves and do my hand hygiene, and I'm going to assess for the posterior thorax. Can you please put down here? And by inspecting it, the posterior thorax, the color is brown, contour is flat, there is no lesions, no scars, and it is symmetrical, no skeletal deformities, no pulsations. And now I'm going to check for the anterior and posterior ratio. So the anterior and posterior ratio is 1:2. Now I'm going to palpate it. Do you feel any pain?
No.
No pain, no tenderness, no masses, good skin turgor, and good moisture. Now I'm going to palpate, doing the tactile parameters. Could you please say 99?
99, 99, 99, 99.
So I can hear the vibration. Now can you please inhale and exhale? So the expansion is good. Thank you so much, Mr. William. Could you please stay there? I'm going to percuss it. Hear any dullness? There is no dullness. Now I'm going to auscultate it. I'm going to auscultate the bronchovesicular and the vesicular. So bronchovesicular is beside the vertebra, and the bronchovesicular is here. I mean, it's the bronchovesicular is medium pitch sound, and the vesicular here is low pitch sound. And I don't hear also any wheezes or murmur. Thank you so much, Mr. William. And the anterior thorax, the rate is 12. Rhythm is regular, and there's no distress of breathing. Now I'm going to check for the bulb locations. So I'm going to check for the aortic. So it is in the right second intercostal space, and the pulmonic is in the second intercostal space to the left. Earth is in third intercostal space to the left, and the tricuspid is in the fifth intercostal space to the left, and the mitral is in the fifth intercostal space mid-clavicular line, which is the apical pulse. Now S1 is usually here in the mitral bulb, and S2 usually here in the pulmonic on the left side. And I don't hear any S3 or S4 sounds, and the apical pulse is 70. The rhythm is regular, and grade strength is 2+. Thank you so much. Now, Mr. William, could you please lay down there? I'm going to check your abdomen. So I'm going to inspect patient's abdomen. So patient's abdomen, the color is brown, hair distribution is good, there's no pulsations, umbilicus is in the middle, good moisture, there's no scars, no lesions, no swelling. Now I'm going to auscultate the patient's abdomen, first in the right lower quadrant. So I don't hear any, peristaltic movement is okay. Now I'm going to check for the aortic. right and left renal, and the iliac, and femoral. So I don't hear any breath sounds. Thank you so much. Now I'm going to go past the abdomen of the patient. So I don't hear any dullness. I'm going to palpate it. Do you feel any pain?
No.
No pain, no tenderness, no masses, and no guarding, no rigidity. Now I'm going to check for the Murphy sign. So please tell me if you feel any pain.
No.
No pain. And here,
No.
so it's negative Murphy sign and negative Blumberg sign. Okay, thank you so much, Mr. William. And we'll do a further testing here. So, Mr. William, I will gonna put this on your skin and tell me, say now when you feel it, okay?
Now. Now. Now.
Thank you so much, Mr. William. Now I'm going to use this. This is sharp and this is dull. Tell me if it's dull or sharp. Still close your eyes. Sharp.
Sharp.
And this is dull.
Dark. Dark.
Sharp. This is sharp and this is dull. Sharp.
Sharp. Dark. Dark.
Sharp.
Sharp.
Okay. So thank you so much, Mr. William. Now I'm going to give you something that you can hold. Still close your eyes.
It's a ball.
And what's this? Oh, sorry. What's this one?
Insert.
Thank you so much, Mr. William. Now I'm going to put your body and tell me what I'm doing. Still close your eyes.
You put my hands up. You put my hands on my lap.
Thank you so much, Mr. William. So the patient is able to identify the sensations that I'm doing. Now I'm going to check for the reflexes. Okay, now I'm going to check for the biceps. Okay, thank you so much. Now I'm going to check for the triceps. Okay, now I'm going to check for the brachialis. Okay, thank you so much. Now I'm going to check for the patellar. Okay, I will check the Achilles. Okay, now I'm going to check for the Babinski. Okay, thank you so much, Mr. William. So the patient reflexes is intact. Now could you please stand up and we'll do a Romberg's test. Close your eyes. So the patient stays. So it's negative Romberg's test. Now could you please do heel to toe walking like this and this. Okay. Now could you please do toe walking like this and heel walking. And we'll do pronator drift like this and close your eyes. So that's good. So the patient is able to do the balance, which is good, and everything is normal. Thank you so much, Mr. William.